What is a stab injury? Stab injury is an injury which is caused when a force is driven along the long axis of a narrow or a pointed object. It will have the effect of penetration of body. It is of three types, where superficially it will be called as a puncture wound, and it will be called as a puncture wound. It will be called as a penetrating wound when it breaches the cavity of of the body, and when it goes through and through, that is enters from one aspect and comes out from the other aspect of body, it will be called as perforating wound. Next, we discussed about Langer lines. These Langer lines will distort the shape of a wound. Okay, I have a question for you. Is this Langer line that is going to distort the shape of a wound, will it be applicable for all kind of wounds, or it will be applicable only in case of stab wounds? Yes. Yes, for all wounds it will be applicable. So what are the 3D injuries that we see which will have this effect? Will it be applicable on 2D injuries also, like contusion and abrasion? Not applicable in 2D injuries because the depth of a wound should be at least dermis deep. And if the injury is not perforating or like not, if any injury is causing, this is like, let's say this is the epidermis and this is the dermis. This fibers, this collagen fibers and elastin fibers are present in the dermis. These are not present in the superficial aspect of the skin. So any injury which distorts these elastin fibers, they will cause distortion. Okay, so it is not applicable in 2D injuries, whereas in 3D injuries it will be applicable. Then we looked at the different characteristics of the wound which are supposed to be mentioned when you are examining a case of such wound. Length, breadth, depth, shape, action. Depth has to be ascertained at the time of autopsy or at the time of operation of the patient in the OT or in autopsy room. Okay. Direction can be by CT scan or imaging modalities we can do, looking for the extravasation, and also we can visualize while doing autopsy or while doing a operation later, while doing surgery upon these kind of patients. Then we looked at different shapes of the wound that are possible with the single-edged knife, that it will cause cutting at one end, sharp of the other. Double-edged knife will produce sharp ends at both the sides. Then different weapons which could produce the same. Then hilt mark saw, when the force is extra high, then it will cause full penetration and maximum force. So it will cause impression of the hilt on skin. It can be in the form of an abrasion or it can be in the form of a contusion. Next, examination. We will go into the theoretical. When we come with the practical exercise of an injury report, then we will see what all things are to be this thing. You people are supposed to make an injury report based upon the cases that are given to you, and it can be in the form of a weapon that is given to you, or it can be in the form of a wet mount of an injury. And based upon that, you have to imagine a scenario where a person would have sustained such injury and make an injury report. We will go into detail aspect of it when we go for a practical session on this. Next is this injury where we saw a hilt mark over here. Medico-legal importance, we saw concealed wound. It can be just certain sites, like in case of rectum, in case of vagina, or just below breasts. There can be concealed stab wounds which would affect the vital organs. Overkill is seen in stab wounds where person, because of jealousy, keeps on stabbing even after the person has, even after the patient has, victim has died. There can be harakiri, which is suicidal in nature. This is homicidal. This is suicidal, where a person stabs himself and laterally incises the wound, laterally ends the wound. That will be incised stab. Impalement injury and bull bore injuries are seen in accidental scenarios. Then we looked at the definition of a choke wound, where the wound weapon is having a sharp cutting edge. It will heavy in its weight and it will cause impression upon the bone. It will cause a fracture or indentation on the bone. Next we saw chop wound. It is in the bone. Description and medical legal importance. Okay, now I would like you people to give me certain answers regarding medical legal importance and laws pertaining to injury. So, how many of you know what is an injury? Raise your hands or give an answer in the chat box. Even if you want to unmute yourself, you can answer directly. Yes. What is an injury? From a medical standpoint or a legal standpoint, is there any difference between the definitions of injury? Yes, yes. Reply fast. Is there any definition in the? Is there any difference in the definition of injury? What is an injury? Damage caused to body by external forces. That is a medical definition. Sabri Vishwas. Any harm or whatever caused illegally, damage to any person in body, mind, reputation and property. That is as per legal definition. So there are two definitions. One is a medical definition and another is a legal definition of injury. Medical definition which says any external force causing damage to body and its structures. So body and its structure include skin, subcutaneous tissue, this components of the skin, components of other bodily parts such as organ systems, bone, muscles, anything. Will hair be counted as an injury? If you cut somebody's hair, will it be counted as an injury? In certain circumstances, this can be. I want you to research upon it, go through the depth of different texts that you may find, and you can look at the. We will have a discussion in the next class. Whether make a list of things which we have to discuss in the next class, and I will be asking you what all have to be discussed from the previous class. So remember this: hair, damage to hair be considered as an injury or not? Okay. Medical definition we have spoken. Now we are going to look at the legal definition of injury. Legal definition of injury says legally injury is any harm whatever caused illegally to person's body body, mind, reputation, and property. Remember this, there are four components in this. It is not restricted to body. It also includes psychological stress. It also includes societal reputation and also property of the person. So it is a wider definition. It does not just limit itself to the definition of human body. Understood? As far as I have come to know that you have been taught all these things, so you should be, just for the sake of revision, I'm going through it again. This is defined as per which section? Answer fast. Which section of IPC describes this, gives this definition? Which section? Section 44 of IPC. Yes, you're right. Sabrish. Okay, when we talk about, then we have gone into 319 and 320. What is 319? Defines hurt. Yes. Accept, Sabrish, nobody is answering. Try, people try. Vishwas has given a good definition of, medical definition of injury. Okay. What is 320? 320 IPC. What do you mean by 320 IPC? People. Grievous hurt. So there are circumstances. Shreyasi Chattopadhyay. Grievous hurt. Yes, yes. Grievous hurt means when the hurt, or hurt means whosoever, from a legal point, it is defined in a manner that whosoever causes bodily pain, disease, or injury to another person is said to have caused hurt to another person, whosoever causes. A hits B on the face. A slaps B on the face. So he has caused bodily pain. That's why A has hurted B. Hurt which can endanger the life. So there are two gradations that have been put forward by the legislature of our country. They said hurt can be divided into two circumstances. One is a simply put hurt. This is not simple hurt, it is just hurt. Simply put hurt. Okay, another grievous hurt. Grievous hurt means when the person has sustained severe form of injury, which for which they have given different criteria. So those criteria are given in section 320 of IPC. It says there are 8 clauses in this, and all 8 clauses have to be memorized by you people. I'm not going to revise everything because this has already been taught. Just because for the sake of Sabri's raising this question of endangering the life, I will just say in the 8th clause we have 3 separate sub-clauses. 1. Any injury which imminently endangers the life of another person. which imminently endangers the life of person will be called as hurt. Let's say assume a scenario where any of these conditions, rest of the 7 conditions, which is emasculation, permanent privation of eye, permanent privation of ear, impairment of member of joint or impairment of power of a member or joint, permanent degradation of face, or fracture of bone or tooth does not apply. Let's assume a scenario in which in a case where these all things do not apply and still person can be taken for grievous hurt. Assume a scenario where stab has been inflicted on the in the inguinal region leading to transection of femoral artery. Okay, in this condition, if we don't treat the patient in an emergency situation, then that injury. So these scenarios have been put forward to cover different aspects of injury. Okay, and you should memorize it. Which imminently endangers the life of a person will be put under section 5th A, first subclause. It will say if a person after sustaining the injury has the risk of dying immediately, if not given treatment, then he will be said to have grievously hurt. If the patient survives because of medical treatment, still it will be rendered as grievous hurt. Next, when person is in body pain for 20 days, he cannot do his routine course for 20 days. That is third. Okay, so based upon this, hurt and grievous hurt, we have different scenarios where punishment can be given differently. After 320, we have 321 and 322. These don't have much work. Signify when do we say that person has been voluntarily suffered voluntarily, A has hit B. Whether this hitting has happened by the voluntary action of A, that B has sustained, whether it was volition of A will be taken into consideration. Whether A has hit B voluntarily, for that circumstances have been defined. If you want to go into detail of it, you can go through this section. So voluntary hurt is 321, voluntary grievous hurt is 322. Okay, when do we say that whatever injury has been inflicted, it was inflicted in a voluntary manner? For that, 321 and 322 are present. Is it clear or not? Yes. Next, we come to section 323 and section 324. Look at this. Hurt. Hurt definition is clear from 319. Whosoever causes body pain, disease or infirmity. But when this hurt has been caused using a simpler mean or a dangerous mean. Let's say A scratches B with a knife. Let's assume a scenario. A scratches B with a knife. A scratched B with a knife. And A scratched B with a pen. Here we will put pen and here we will put a knife. Which has more likelihood of attracting a severe penalty? Scenario 1 or scenario 2? Which scenario will attract a higher penalty? Knife. Yes. because knife has an additional effect of inciting fear into the person who is sustaining the injury. So, so lawmakers have made this distinction in the beginning itself, where 323 pertains to inflicting hurt by simpler means. So the punishment for this will be lesser. Whereas punishment for scenario B, where A has caused injury to B, same injury to B, hurt to B, using dangerous weapon. Dangerous weapon. So what are dangerous weapons? That they have also defined in section 324, 324 and 326. Similar situation will apply in grievous hurt, where dangerous weapons and dangerous means have been used. So let's assume a scenario. A fired at B. A fired a gunshot on B. The bullet grazed the superficial skin, producing an abrasion, and passed off. It did not cause breach of any this thing, any body cavity. It did not enter the body. It just grazed from the superficial aspect of skin. Let's say it just grazed the shoulder without causing any injury underneath. So this scenario will be what kind of scenario? 323, 324, 325, 326. A fired gunshot at B. Shooting, stabbing and cutting weapon is dangerous. Section 324, yes. So now we look at the definition of dangerous weapons. Here you can see what are dangerous weapons. Dangerous weapons include anything which can cut, stab, anything which can cut or stab or fire, shoot, cut, stab or shoot will be called as dangerous weapon. And there are dangerous means, this is weapon, and there are means also. In means we have fire, poisonous substance, which has the effect of causing disease in a person, infectious organisms, and lastly, animal. Poison, infectious organism, infectious agent, fire. So these are included in section 324 and section 326 of IPC. These are defined in section 324 and 326 of IPC. This will be asked to you at many stages, starting from your Viva to MCQs also. So looking at it, we go back and see A throws acid on B. A throws acid on B. Will it be called, which section will apply to it now? A throws acid on B. Which section will apply against A? Sabarish, no, Shreyashi. Section 320. See, 320 defines grievance. whenever a charge is put against somebody, you will have to see the scenario. Police person will look at the scenario and will file as per what is where punishment is defined. So definition of an offense is for the sake of lawmakers, whereas for police people we will go with whenever a person commits a crime, police person will file a case as per the offense, as per the punishment, wherever the punishment is defined, from that perspective the case will be filed. So 300 defines murder, but police person when registers a case against somebody, he will file the case under 302 of IPC. Similarly, whenever a police person has to file a case, looking at the scenario, A has thrown acid on B, then he will take into account where is the section defined. From the previous understanding, we saw that poison was included in section 324 and 326. Through acid, it landed on the hand of a person and it caused superficial burns. That does not endanger his life also, that does not satisfy any clause of 320, then the case will be filed under 324. Similar acid thrown on the face of a person. This is earlier, before CAA came into existence. That was before 2013, I am telling. Now the scenario has changed. A similar case, if patient has, the acid has been thrown on the face of a person, that time case used to be filed under 326. But after criminal law amendment 2013, they introduced two new sections, 326A and 326B. 326A and 326B. 326A says whenever a person has sustained injury due to acid attack, whether it is severe or a simple injury or any person sustained injury due to acid attack, case is filed under 326A. Here the punishment will be higher. Punishment will be higher. Remember this thing. Somebody who has sustained acid attack injury, who has inflicted acid attack injury, will be prosecuted under section 326A. Whereas even if A threw acid on B, even if B did not sustain any injury, the act of A throwing acid itself is legally punishable. This punishment was introduced by section 326B. Okay, so now if you ask today, then if you see a question earlier before 2013, if you see a question or MCQ prior to 2013, there you will find that answer has been given either 324 or 326. But now after 2013, the definitions have changed and the answer will become 326 and 3A and 326B. Now the attempt itself is punishable. Remember this is going to be very helpful in your exams. We have seen the definition of dangerous means and dangerous weapons. Okay, just to revise, if you want to write it down, you can write it also. 324 IPC, 326 IPC deal with definition of hurt and grievous hurt by dangerous weapons and dangerous means. What are these dangerous weapons and dangerous means? It has been cleared in these respective sections that whichever weapon has the effect of cutting, stabbing, or shooting. Third, means. Next is means, where they have defined that fire or a heated substance or poison or a corrosive substance. Or substances are deleterious to human beings, including infectious agents and use of animals. I think my presentation is not loading afterwards. Okay. We will get another circumstance. Okay. See it now. A has inflicted injury to B in an accidental manner. A has inflicted injury to B in an accidental manner. Rash and negligent act of A has caused injury to B. We'll assume multiple scenarios in this. A was driving under the influence of alcohol. A, being a bus driver, under the influence of alcohol, he is driving. He is endangering the life and safety of co-passengers. He is endangering the life and safety of passengers who are traveling in that bus. So, section 336 will apply. Section 336 will apply to punish A for this act. So, okay, we are talking about all these things. First, let's be clear about what is an offense. Anybody who would like to contribute upon it? What is an offense? Act of omission or commission. Any act which is omitted, if omitted or committed, that is contrary to the law. Contrary to the law or made punishable by the law. That is known as an offense. So, rash driving or driving under the influence of alcohol is made punishable by Motor Vehicle Act. So, whenever that any person does it, then he will be punished as per provisions of Motor Vehicle Act also, and yes, he will be punished by Section 336 IPC also. Although I'm taking example of a driver, but there can be other circumstances also where this section may apply, where the rash and negligent, a doctor operating upon another person, a doctor operating on a patient under the influence of alcohol has likelihood of committing a mistake and endangering the life and safety of that human being. So in that case also this apply. Next, we are seeing my iPad right now is not functioning because of low charging, so I'll not be able to use pencil. Next, what we are seeing is definition of section 337. Section 337 says rash and negligent act of a person inflicting hurt on another person will be prosecuted under this section. A, while driving rashly hit B and B sustained hurt. A while driving sustained injury. A while driving in a rash and negligent fashion inflicted hurt on B, so A will be prosecuted under section 337. Similarly, if the injury is grievous in nature, if it satisfies any of the clause of section 320 IPC, then A will be punished by section 338. And the third circumstance is when B dies. When B has died, that time the patient A will be subjected to punishment as per the provisions of section 304A. It is also known as criminal negligence section. It is also known as criminal negligence section. Am I audible? Okay. If while operating, Dr. A performs operation on patient B under the influence of alcohol, first he will be prosecuted under 336 life and safety, endangering life and safety, 336. Second thing, these sections will keep on adding. When the charge is filed, these will be added on. Next will be if the B sustains only hurt, 337 will be added. If B sustains grievous hurt, then section 338 will be added instead of 337. And if B dies, then section 304A will be added instead of 337 or 338. Remember this, these sections are asked quite frequently. Even the punishment for the 304A has been asked in different exams. So I'll tell you, it is 2 years imprisonment. You don't have to go for the punishment of all the offenses that are there. It is for the judges and lawyers to argue upon and decide. Doctors don't have to go into the punishment for each and everything. So just remember for certain sections which will be pointed out to you people at different stages. 304A punishment is 2 years. A driving rashly caused death of B. A driving rashly caused death of B. He will be prosecuted under section. Yes, I want answer from you people. A driving rashly caused death of B. (336) endangering the life and safety. Okay, that will be applicable, but here the death has happened. Remember what was told just a minute back. Here death has happened, so 304A will apply. Okay.